are here. Thank you all for joining us. I've got the lovely Claire with me from Vale Cranial to talk about her cranial sacral therapy work. So this is Claire Brandreth, fully qualified craniosacral therapist and canine craniosacral therapist, certified by the Upledger Institute. That's a mouthful and a half, isn't it? Claire's been doing cranial sacral therapy, what CST we will call that at the moment, for just to save my tongue from falling out of my head. When a friend recommended the treatment to you for your newly born daughter, and then from that point you've gone on and on and on, and you've got so many qualifications to go through. I won't read them all out, but there are several there. If you want to have a look at Claire's Facebook page, website, Vale Cranial Therapy. Based in Staunton, West Sussex in England. So welcome to you, Claire. Thank you for agreeing to join us, jumping into the pit like this. This is great. So let me hand it over to you, and we'll let you crack on. I think you've got some slides for us as well. So over to you. Thank you for joining us.
Lovely, thank you. Okay, so let me share my screen. Okay. Seconds. Can you see it?
Yes, I can see that. Yep.
Right, let me make that large and let me get rid of myself. Okay, so thank you for the introduction. I'm a bit nervous, so it's really out of my comfort zone doing something like this. So I've also got dyslexia, so if I do have a little bit of a fumble over some words, please do forgive me. And if I go a bit fast or you want clarification on anything, again, just shout. Sorry?
It's all good, don't worry.
I'm really passionate about the love of animals and cranial and bringing them together, because I just think dogs deserve the same as humans, you know, the kind, gentle approach. So yeah, I shall get on with the presentation. Okay, so as Mark said, I came into the cranial through my daughter. She was fused from the neck down to the pelvis, and she couldn't turn. A few treatments of CST, and she then became fluid and moving, and it just blew my mind. So that's when I decided to come into it. Treating humans is amazing, but I have a love of animals. You know, I've grown up with horses, I've grown up with dogs. I also treat horses or any animal who has a cranial sacral system. So the way I started was with my dog, Luna, here, the one with the collar. So she came to us as a pup. Everything was fine. Then she was running in the garden, and I was hearing a bit of wheezing. I thought, oh, you know, it's not quite right. It was in the second lockdown. So she went to the vet to have her second jab, and they said she had PDA, so parent ductus arterius. So that is where the duct in the heart hasn't closed. It should close as soon as they're born and they take their first breath, because it bypasses. So to help her, I started treating her heart and her lungs, and then she had to have an emergency heart operation at 11 weeks old. I then, she came back, and again, I was helping her recover and treated her through that, and now she's absolutely fighting fit and a bit of a lunatic, so it's all good. And then Zion, my boy here, posing in front of Mark's car. So he is an ongoing thing. He's an absolute sweetheart. He's gentle, kind, but as soon as he walks out the door, he thinks everything's going to kill him, so he's a bit scared of everything. So working with Mark weekly to help him over that, as well as working with CST on him. He's come on leaps and bounds with the two working together. So, but he's an ongoing project. Down in the corner, my Facebook cover has been done by lovely Naomi, Mark's wife, and also my Vale Cranial She designed them all, and she's amazing. So if anybody wants anything, I'll go to her. Okay, so on with the first slide. Oh, why is that not going? Oh, hang on. There we go. So cranial sacral therapy. First of all, I'm just going to give you a bit of a background of where it's come from, who found it. I'm not going to go into too much detail. So who discovered the cranial sacral system? The investigation in this field began in the 20th century by Dr. William G. Sutherland, who developed cranial osteopathy. Dr. Sutherland was influenced by his teacher, Andrew T. Steele, the founder of osteopathy. Then Dr. John Upledger was a student of Dr. Sutherland and trained as a surgeon, clinical researcher, and osteophysician. After assessing a patient's neck surgery in the 70s, he observed the rhythm motion of the dural membrane. So he was asked to hold it still, and it wouldn't stop moving. And so it sparked his sort of like intrigue to see exactly what this thing was. So that's how him up in the corner. It led to the field of cranial manipulation and to theorize that cranial bones allow for movement through adulthood. Previously, it was only thought that infants' heads had the movement in the bones while they were developing. So Dr. Upledger was a professor of biomechanics and a clinical researcher between 75 and 83 at Michigan State University. And then further investigation led to the hypothesis of the cranial sacral dura mater and cerebral spinal fluid being integrated into a comprehensive model of the cranial sacral system. So we'll go all into that in a bit more. Dr. Upledger founded the Upledger Institute International, bit of a mouthful, in 85. So that's in America. The Institute is a health resource center dedicated to the advancement and innovation techniques that can complement sort of like, you know, normal doctors, and it just sort of helps in other ways. It's recognised worldwide for its groundbreaking continuing educational programs, clinical research and therapeutic services. So they're constantly finding more research, so it's very scientifically based. Over 150,000 practitioners in more than 122 countries have trained with Upledger. Cranial sacral therapy is taught through the Institute, is designed to relieve health problems at their source. So that's just a bit of a background of, you know, where it's come from. Cranial sacral therapy is a holistic, safe, gentle, and effective manual therapy that works by helping the dog's own natural healing powers to remove or lessen the negative effects of stress and injury. So as a CST therapist, we don't diagnose. That's not our scope of practice. You know, we're not doctors and we're not vets. So we follow the body. CST is a hands-on technique that uses a light touch, 5 grams, to examine a tissue, fluids that surround the central nervous system. So 5 grams, extremely light touch. If you ever have a 20p piece next to you, pop it on the back of your hand, and that is basically the pressure that we would use. Sometimes the tissue of the dog may pull my touch in a little deeper and a little heavier, but that's okay because the body's asked for it. It's not me deciding that I'm going to put more force onto the dog's tissue. CST is always client-led, be it human or dog or animal or sheep or whatever. The main ethos, along with a light touch, is use time over force. So time over force, we allow the body structure to release and move when it feels ready to. For example, if I'm on a shoulder, I might be there for a good part of the session, or the shoulder may partly release, but it's not ready to fully release. In that situation, I'll either come back to the shoulder later on in the session or in another session. You know, I don't force a full release when because the tissue's just not ready. I'm not going to force it to do anything. I'll always reevaluate and release to see if the restriction's gone or partly gone or lessened, or but still needs more work. Because if you force a muscle to release, all you're really learning about is something called muscle guarding. And this is where the muscle shows you the resistance, and not what, you don't want to find that the muscle's resisting you to release. You want the muscle to work with you. For example, chiropractor, when, I don't know if you've ever been to a chiropractor, they say, okay, relax your neck. I'm going to just manipulate it, click it, deep breath, and then relax. I don't know if any of you can fully relax. I know I can never do it. And I'm always a bit sort of tense and bracing when I used to go to chiropractors. So it's that kind of set. The muscle isn't going to show you that it can release, because it's got that little bit of guarding if you put a lot of force on it. So CST uses time to release instead of force to release. Okay. What makes up the craniosacral system? So all animals have a craniosacral system, from a mouse to an elephant. The craniosacral system is made up of the bones of the skull. 3 layers of membranes known as the meninges protect the brain and spinal cord, your central nervous system. The delicate inner layer is called the pia mater. The middle layer is the arachnoid web-like structure, and it's filled with the CSF, the spinal fluid. That cushions your brain and travels down your spine. The outer layer is a tough waterproof layer that's called the dura mater. So that's the one which is closest to your skull. The craniosacral system is a physiological system that is responsible for the production, circulation, and reabsorption of the spinal fluid. Dr. Upledger named this the pressure stat model. Okay.
Just out of interest, that's a pressure stat model. What is it again, and how does that work?
Okay, so he was very sort of mechanical minded, Dr. John, we call him, and he used to call it the semi-closed hydraulic system. So the CSF, the fluid, is made in the brain, then it circulates the brain, travels down the spinal cord, then back up, and then circulates the brain again. It feeds the brain. The fluid is continually draining into the body. The brain will continually make the fluid until the system's full. So your brain is full. The body will know when the system is full by the skull. It will stretch. And when it's got to its maximum, there's little receptors in your sutures that send a signal to your brain to say, oh, stop, don't make any more. We can't cope with any more. So the brain will stop making the fluid, and then it will drain out of that system. And then the skull will then close back down, and there's another set of receptors which go, oh, right, okay, the skull is now close. We need to start making it again. So that travels to the brain to kickstart. So then it starts filling up. So it's a continuous reproduction and moving. And that's what causes it, that's what makes the rhythm. Human has 6 to 12 cycles per minute. So it will reproduce 6 to 12 times every minute. Filling and draining of CSF through the system is reflected through the whole body. So your limbs, although we can't feel them, as to the trained, to the every normal person, you can if you sort of start to train your hands, but the body will start to go in and out, in and out. The limbs will start to go in and out. Same with the dog. The shoulders will go in and out, pelvis, forelimbs. And that's how you can tell the rhythm of the dog. It's extremely important because it tells me if the system's working normally or if there's an abnormality in the system somewhere. Okay. Does that make sense?
Yeah, it does make sense. Yeah, I mean, and again, I suppose it's a little bit tricky. Obviously, with a human, they can kind of tell you what's kind of going on, but then with a dog, you are relying purely on what their body is telling you, and then obviously you're looking at sort of the calming signals, that kind of stuff that the dog might be giving off in certain situations, I suppose. But is there a big difference in the way that you would work, whether that's a dog or a person?
No, I call them little people with four legs, basically, because the cranial sacral system is identical to a human, dog, sheep, rabbit, elephant. It's exactly it works in the same way. So I would then treat the dog in the same way. Obviously, they've got different, structures, but basically, it's the same principle.
Okay, so I mean, if you took that kind of scenario, so let's just say that somebody wanted you to work on their elephant, and I know that obviously we do the placing of the hands to feel the rhythm, that kind of thing. I mean, would that then need, the bigger the animal, the bigger the hands, or does it go down to a narrow point?
So yeah, I shall go on to my next slide. So basically, yeah, that's the thing is you can work on any size. You can work on like little puppy Lara here. All you would do would change the hand placement. So I would maybe adjust using my fingers instead of my whole hand for her little nasal release, or her little occiput, back of the head release, or her little vertebrae smaller. So I would just literally change it. And with puppies, mindful of their development stages as well. With larger dogs or elephants, I may use a whole hand, or I may use two hands, or I may treat the area in two separate parts, so I can cover that whole area, basically. It's the same with babies and toddlers, I have to change my positions to working on an adult. So you just literally see what you've got and then treat it, basically.
Okay. I mean, does it matter then about say thickness of the skin or thickness of fur or anything like that at all? Does that make a difference to what you can feel?
No, not at all. Not at all. Because we train our hands, we can work, for instance, humans, they can have thick jeans on, or big jumpers. I can still feel down through into the tissue and the movement of the tissue. So it doesn't matter what coats they've got. They could be St. Bernard with a thick coat, or a greyhound with hardly anything.
Oh, okay. Cool. Okay. Well, yeah, I've been sort of, I keep getting questions, and I thought I'd better ask them in my head. So I'll let you carry on again.
Fine, that's fine. So next slide. What does CST do? Okay. CST addresses the restrictions in the physiological movement of the cranial vault, so your head, the cervical spine, the thoracic and lumbar spine, sacral and pelvic region, the coccygeal region, so the base of the tail or the tail, and all of its fascial connection, including the extremities. CST balances tissue tension around the brain and spinal cord in order to enhance self-correction or self-regulatory mechanisms in the body. It can affect any tissue, any level, including but not limited to bone, fascia, dura, muscles, tendon, ligaments, arteries, veins, nerves, blood, lymph, and CSF. Quite a long list there. CST helps rebalance the automatic nervous system, so as well as down-regulating the sympathetic nervous system. So we all have heard of flight and fight response, and up-regulating the parasympathetic, so the rest and digest response. All animals' immune systems and endocrine systems also receive beneficial rebalancing effects from CST. So basically, the body's made up of lots and lots of layers. Okay, it's like an onion, as I always describe it. Knocks and bangs get caught in these different layers. Every dog is different in a unique set of strains and compensations. In treatments, things will come up, they may release, but in their own order. So what I mean by this is the body will decide what it needs to release, when it needs to release. So, for instance, a dog may come into me with an injured foot, but the body, when I put my hands on, the body may show that there's a restriction in the pelvis, you know. So in order to release and help the foot, the pelvis needs to release first. So I will always treat the foot and what they've come in with, but whatever the body has shown me extra, I treat that as well. So it's, you know, it's a very fluid kind of thing. Okay.
So how do you, in that case, how do you feel what's going on? I mean, how do you feel between the difference between different layers, bone, muscle, that kind of thing?
Okay, so I'll go through this slide first and then I'll get onto that bit. So our hands are really sensitive. They're like antennae for receiving information from the dog's body. There's a total of 17,000 touch receptors and 3 nerve endings in the palms and fingers. These pick up sensations of pressure, movement, vibrations from the bone, tissue, fluid under the skin. We develop these as CST therapists. We develop these receptors and give us the ability to find where there's the restriction in the dog's body. So I do this through palpation. I can explore the structures beneath the skin, their form, the movement, the relationship to each other, the normal or abnormal function of an organ, the mobility of muscles, ligaments, tendons, and also get a sense of how well the fluid is flowing, because we're made up of fluid basically, and dogs. The structure, sensation, pressure, movement, vibrations from the bone, tissue. Oh, what's that?
No, you're okay.
Each structure has its own feel. You get to learn the different feels of, for instance, the bone, muscle. For example, an organ, a healthy lung has like a rebounding feel, a spring to it, where a lung which has got an infection or has had an infection will feel tacky. And, you know, like when you put your hand in sort of treacle or syrup and then you pull your hand away, it's got that stringy sort of tacky pull to it. Bone feels really quite dense, although it's not dense when it's alive. Where fascia, you know, if you ever get a slab of meat, you've got that kind of white film kind of thing over it. It's like a bit of a spider web. That's fascia, and it's through the whole body. That feels light and wispy, like a spider's web, or candy floss, you know, when it goes around and it's not on the stick yet, that kind of feel is light and airy. So you just get to learn the different structures and you know, when more you do it. So there you go.
Okay, we've got a question. Zoe Carter has sent a question in. She said, good evening, first of all. She's asked, are there similarities to McTimoney? If not, can you say how it's different, please?
Oh my goodness. I couldn't really, it is similar. Gosh, you put me on the spot here. Yeah, it is similar, but I'm not overly familiar with McTimoney, so I couldn't really say. I would have to go and have a look and research it, really.
I'm assuming, Zoe, McTimoney does a kind of a similar thing where it's hands-on, but it's not forcing things to release. It's more of the body. If you want to, Zoe, do you want to just pop another little line up just to explain who McTimoney is, and we can have another look at that in a bit later. But I don't know who that is, and it's all new. The thing is, all this is new to me, so it's just good to listen to it. But so Zoe's put, sorry, it's okay not to know. Yes, exactly. There you go.
Okay, I will look it up. And I can contact you if you want. I'll look it up and research it, and then I can tell you the difference between it if you want me to. That's no problem at all. And
also, if Zoe, if you know anybody that does practice, if there's a particular McTimoney method, we'd love to get them on for a chat. because it's another interesting one to have. It's something we like to find, these different things that perhaps aren't as well known. So if there is somebody out there that's practicing whatever McTimoney is doing, well, great, get someone to get in touch and we can get them on and do another live with them as well. Anyway, so Claire, sorry, back to you then. So we've gone over how you feel the difference between bone muscle and different layers, and that, I suppose that, yes, you are taught how to feel that, but I suppose most of that is going to come with experience. The more you do, the easier it is to understand that, I suppose, in that aspect.
Totally. And the more people you do and dogs you do, you get to know the different layers. For instance, babies' layers are a lot finer in a way than adults, so you just feel what you know and then just refine it a bit for the babies.
Oh, okay. So would you have an average appointment time, and would it be half an hour, would it be an hour, 2 hours, would it depend on whether that was a baby, an adult, and giraffe taking
I think I'll get a giraffe in my cranial room, but yeah, absolutely. So basically, treatment time, actually hands-on physical treating the tissue, is roughly about 30 minutes, but the appointment time is an hour. And the reason for this is the dog's body will only really cope with 30 minutes treatment time. Same with babies, because they're quite sensitive, bless them. And I don't want to over treat an area and then the dog gets sore and then have a negative experience of the treatment and then not want to come back or be treated again. So I'm very strict with, the dog's had enough. For puppies, sometimes it's 20 minutes. You've got to respect that, they can't take an hour. Plus, also, I want to keep the treatment time relaxed as well. So takes the pressure off treating the dog. It comes straight in, gets treated, and then goes. It just makes it a little bit more chilled out. If the dog looks like it needs a break for a bit, I can then stop and give it what it needs. Also, they sometimes take time to settle, new area or whatever. There's tissue may be a little bit more resistant, so again, you just take your time. And puppies, they love smelling, don't they? They love to explore. So instead of forcing that puppy to go, right, okay, this is your treatment time, we've got to stop, let it explore, let it have a sniff, let it have fun. It's like treating a toddler. Half the time I'm running under the table treating toddlers. And, it's just like, hands on, and then we're off again. So it just makes everything more relaxed. Clients can bring their own dog's bed in. That's absolutely fine. Bring whatever they want, which will help the dog relax and feel at home, basically. If they want their licky mats or squeaky toys, anything that makes the dog happy, really, while being treated. So that's a good thing.
We've got a comment here from Scarlett. She said, hi all. I think CST would be really helpful for our very anxious rescue dog, Sherlock. And I know Sherlock very well. But Sherlock wouldn't cope with someone else other than her or a partner touching him. Now, I know that to be true. Unless he knows you well, then he won't like it at all. Is there anything that she can do at home to support him that's similar to CST? Now, Sherlock does love a gentle head massage and a chest rub. He falls asleep almost instantly when they do this. Any advice, please?
Absolutely. I could even teach you like the basics of, like, it's called a still point, which I will be coming into later, which brings down the nervous system and helps the parasympathetic. And it's really quite easy to do. I've taught humans to do it as a sort of like a stopgap between appointments. So something simple like that is brilliant for taking home and just to help him relax and chill out, sort of thing, and easy to do.
Lovely. And yeah, Scarlett, you can always message Claire direct on the website, and you've also got a Facebook page as well that you can contact Claire through.
Also,
Maybe have a have a chat.
Yeah, and absolutely. I mean, you could always come over and I can show you on Luna, my girl, of what to feel and how to feel it, because she's absolutely fine, and obviously not Zion, but Luna would be fine. So I could show you that on a dog that's quite happy to be touched and stuff. But then you can take it to Sherlock.
Well, I think the only problem with that is I think once Scarlett meets Luna, she might want to take Luna home.
Oh, she can.
so that you might have a problem with that, because Luna is lovely. She's called Miss Tick for a reason. Okie dokie. So you're looking at this. You've done your half an hour session. You've been there for an hour, and you've kind of gone through a bit. How do you assess as you go through how the flow of it all is, how it's gone, how well it's kind of affected the dog, that kind of thing?
Okay, so first of all, with this slide, a massive key is also looking at the asymmetry of the face. So here, Rima, her eyes are level, her nose level here, her ears are level. If a dog had issues, say, with their sphenoid bone, one eye may be up here a bit. Or if they had trouble with their parietal bones, one ear may have dropped. So I assess the dog. Obviously, the gaits, can do that outside or in the clinic, and just generally look for this. Always take a case history, because not everybody, like rescue dogs, have them from pups. So it's the background, and physically as well. Somebody may have got a dog and is just goes on gentle walks, but that dog for the first 5 years or did flyball, so that's going to put a thing through its whole system. So that's why I do the case histories. Let me go on to my next slide. Just to interrupt just briefly, Scarlett said thank you. He really needs some support as he's so heightened all the time. She has put, yes, I'll swap with Luna. So you may be getting Sherlock. Oh, that's fine. That's fine. Sorry, yeah, carry on. So assessing the flow of CSF, so the fluid that's around the brain and the spine. How I would use this is by listening stations to work out where the restrictions are in the body. So evaluating the square. So here on the pelvis, I am feeling that there's symmetry between each hip and the movement. The same with the shoulders and the forearm. This is Zion, by the way, and excuse the colour of the socks. I've just noticed that. So, and he's brilliant. He's a really good boy. So I evaluate the square at the scapula, pelvis, cranial vault, and at the end of the tail. Also, I may do the rib cage or the hind limb, forelimb, depending. Then I arc. Okay, I've got a couple of questions for you, because you said a couple of things there, and I went, "Oh, what's that?" So the first one, what you say? Did you say square? Square. Sorry, yeah. What's square? Square. It's short for symmetry, qualitude, amplitude, and rate of the cranial sacral rhythm, which is made by the fluid flow of the CSF. So symmetry is how even the movement is between each side of the dog. For instance, one side of the dog may be moving slower than the other side. So that would be like, oh, okay, why is it moving a little bit slower? What's going on there? Quality is how smooth the motion is. So you'll be the pelvis should be going like this, nice and smooth in time. And if it's nice and smooth, it shows the vitality of the system, how healthy that system is. Amplitude is the movement, how big it is. Is it a big extension, or is it a tiny little whisper of a movement? You can barely feel it. So if it's a nice big full movement, that shows me that it's got energy to be able to repair itself. The body can repair. If it's tiny, very faint whisper of a movement, that shows me that it's not got as much energy to be able to repair itself. So it needs a little bit more help. There's something going on somewhere else. And rate is just simply how many times the body goes through that cycle. So we go 6 to 12 humans. If it's a smaller animal, it's a lot quicker. It's a faster rate because there's less body for the CSF to have to travel around. So an elephant would be like huge and slow. So the square tells me how the fluid is flowing through the system. If there's a restriction in the tissue, it will affect that square. So if there's a restriction in the shoulder, I won't feel anything. There won't be any movement. And then I will arc. And you're going to say, what's arcing, aren't you?
Yeah, pretty much, yeah.
Okay, so arcing is where I feel for a disturbance in the tissue and the fluid, and then I'll track it through the body, and then I'll come to the area of dysfunction. I'll work to release that restriction and tension. I'll re-arc to see if it's still there or if it's lessened or gone. So how I feel that, so you can imagine a pond that's really still, and you get a pebble and you drop it into that pond, you get little ripples coming out, don't you? So the closer to the stone, the smaller the ripples, but quite strong. And as it dissipates, the ripples get bigger and smoother. So I almost basically feel ripples in the tissue. And as the ripples get stronger and stronger, and then they stop, that's where the restriction is. That's where that pebble's dropped in. And then that's where I will be treating. So that's arcing.
Excellent stuff. We're learning lots of stuff that I like this. This is very, very, very interesting. Yes. Oh. Sorry, go on. I don't want to interrupt. I want to hear more.
Okay, so releasing the body. Here are my little models. So nasals. I will go through a few of these as well, but so a nasal release is really good if the dog wears a muzzle. It's clamped over the nose. Same for instance, the nose release. If we say, for instance, you've got a beagle and it's constantly got its nose to the ground, and then it juts it down into that floor, it can cause a restriction. The spicles, the dog's pulls on a collar, or it can just release these vertebra. I can't say it.
Breathing.
You can read it. You can read it.
Breathing. That's it.
Breathing, that's it. So that releases like the fascia, but I will come into that one. OCB, so that's releasing the first vertebra away from the occiput. So some breeds have their vertebra really quite high. It can put pressure into that occiput, and it can get jammed quite quickly, like red setters, pointers, they're very straight in the neck, right into that occiput. And lumbosacral, again, it's pelvis release. That dogs carry loads of issues in their pelvis area. Okay.
Sure, I mean, all these things that you've got the pictures of here, it's probably important to say that people shouldn't be attempting this without knowing what they're doing.
No, please don't. Please don't. No, because at the end of the day, you are actually physically moving the bones of the body. So if you do it wrong, you can do more harm than good. So dogs have quite minute feel. So if there's a restriction there anyway, it's going to be even harder to feel what you're doing. So yeah, please don't.
Yeah, always seek advice, people. Don't do this at home.
Yes. So still point. This helps. So this is good for Sherlock. Okay. This will help the body find homeostasis. So we're always seeking homeostasis in the body, humans, animals. It's like if done at the end of a session, it's like a computer reboot. So it then stores all the changes that have happened in that session into the tissue. It changes the central nervous system to the parasympathetic nervous system, so the rest and digest kind of thing. That's the only time I will actually physically do something to the cranial sacral system. So I'm putting a stop of the production of the fluid. So I'm just almost saying to the brain, okay, we're going to stop here. And then fluid builds up, builds up, builds up. And then I'll release it when it's ready, and it flushes through any like minor tweaks and issues in the system. So it's a really good one. Diaphragm releases. So this is a diaphragm release. This will mobilize the transverse fascia dysfunction. It's a bit of a mouthful. The fascia runs two ways. So you've got longitudinal, transverse. So in humans, transverse, if we didn't have our transverse fascia, our heart, our lungs, our stuff would all end up in our legs. So it keeps everything in place. And the same with the dogs and animals. Releasing these allows for more effective releases of the dural tube. So that the sheath that goes over down the spine and the surrounding membranes. So it just makes everything a little bit more effective. Pelvic diaphragm will assist in the function of the hind limb, so the power, drive, acceleration. It rebalances the abdominal muscles, which helps maintain the body line of the dog. Also helps with sciatica, as the nerve passes through the pelvic inlet. So that's a really good one if, you know, it's starting to pinch. Thoracic inlet, I haven't got a picture here actually, assists the forelimb, so the shock absorbing, the navigation, the direction, you know, all those forces go through into the chest and forearms. There's access quite early on to the vagus nerve and the sympathetic trunk, so it's a really good one for a nervous dog because you're straight onto the vagus nerve, which does rest and digest. So, and also it's quite comforting for the dog because you're not going around its head. You know, nervous dogs, obviously, they don't particularly like their heads being touched straight in or whatever. So it's a good sort of like, oh, you know, hi, how are you doing? Sort of, and then they start to get that, oh, yeah, okay, yeah, I'm fine. Yeah, it's not bad. So that kind of thing. Frontal and parietal releases. So they're two different releases. One or both can be jammed. So you've got your frontal and your parietals, same in the dog. If they're stuck, they can lead to headaches, head shaking and tossing, lack of concentration and nervousness. So Zion, his parietals are a bit jammed. It could be from birth. It could be from a knock when he was a pup. Who knows? But I think it may contribute to how he is, as well as all the other factors that Mark helps train with. Temporal, mandible and maxilla, again, all three different releases. These can help with TMJ pain, so up here the joint pain, difficult chewing, dropping food, change of appetite, restlessness, can also be closely linked to the teeth. TMJ technique can help pain, which may be related to behavioural, and as well as body function, so balance, coordination, performance. If I'm going too fast, please let me know, and I'll slow it down a bit.
It's all good. It's all good. And don't forget, this is being recorded, so we will be posting this again at a later stage as well, a couple of weeks' time. Plus, you can always contact Claire through the Facebook page or her website. If you've got any questions or want to book a session or find out more about it, then please do get in touch.
Perfect. Also, I don't know if you know, but stressed dogs can, you know, like humans clench their teeth, you know, they grind and clench. Dogs can do it too. And they've got huge, powerful jaws. So if they clench their teeth, their masseter and temporalis muscles, which come over here, because they're quite big for dogs because they have such powerful jaws, can get really tight. And then it clamps down again on those bones. So the bones can't move, which again is a knock-on effect to the whole system. Also, if dogs have had teeth removed, usually huge amount of force put through the maxilla and mandible into the TMJ bone. I don't know if anybody's ever had any teeth removed, like the dentist is on your chest pulling it out. It's quite forceful. So dogs' teeth are a lot stronger than ours. So the amount of force that will need to be used then just puts dysfunction and compressions all the way through the jaws. So you can then end up with a dog with painful jaws and TMJ joint. So lacrimal release. Okay, so this one is really good for, it helps with dry eyes, problems with vision, balance issues. It can help with dogs that wear muzzles. So my boy, I do this on a regular occasion, regular sessions, because he sniffs down on the floor with his muzzle and he shoves his muzzle up and his muzzle, the rim goes right up. So your lacrimal bones are right in the corner of your eye and they can get compressed with force. So it's brilliant for decompressing that bone. They're very tiny and very fragile little bones, and it doesn't take a lot to compress them. Dual rock and glide. This helps flush out tweaks and rebalances the dog's nervous system, and brilliant for the cranial sacral system. Basically, it's a really nice one to do. Babies love it as well, and actually humans. It's a real nice sort of technique. Has a calming effect on the dog, and it's nice also when you treat like the babies and they've been screaming. You do that and they go to sleep. It's just like, oh, okay. So, and it's good for any spinal issues and vertebral issues. Next, hyoid bone. So here, ours is floating. So we have 24 muscles keeping it in place, where the dog's is actually attached. It's very important for taste, balance, hearing, and feeling. It connects with the larynx and pharynx and tongue. It also helps, this release, it also helps with the lymph drainage from the head and face, which is always good to get that drainage going. The release of the hyoid bone will help, can also help pain, again, maybe behavioural, and it's good for the performance and coordination of the dog. Pelvis and SI joint releases, again, two different things. The pelvis release stimulates, again, the parasympathetic, which has a relaxing effect, as we know. The SI joint releases the ligament restrictions in the SI joint, allows for the sacrum and ilia to sort of like rebalance and synchronize. As you know, dogs do tight twists and jumps up in the air and twist their pelvis. So there's quite a few restrictions that can go into that. Okay, my next slide. Signs of release. Okay, so there's a big list. Tissue softening, tissue lengthening, global or local or global, increased fluid flow, increased energy flow, heat, therapeutic pulse. So you'll feel, or I feel, it would be like a little pulse, like you feel on your hand, and it'll get bigger and bigger and bigger to a certain point, and then it starts decreasing. So that's where the body is doing its thing, you know, it's releasing the fibers in the muscle, etc. Increased gut sound, releasing gas, bowel movements, urination, lying down, getting comfy, softening eyes, relaxed, licking or chewing, biting, licking the area of it being released, or a limb near it, yawning. So that's quite good. So you know when dogs do their stress yawn, so they are trying to do their own still point. It's trying to bring their parasympathetic nervous system down themselves. Same as humans, you yawn, you go, oh, it almost is a bit of a relaxing thing. Breath changes, decrease in rate, sighing, often they pant before a release, energetic repelling, so it feels like it's pushing my hand off, like the muscles going, right, I'm done, you don't need to do anymore. not all these releases happen at the same time, so we don't have like exploding dogs in the room. Some dogs may show the outward signs of like the yawning, the licking, chewing, and then some dogs may not. They just may be the internal, so I feel the heat or the therapeutic pulse. It's difficult to say which ones they're going to do. You can't really say, actually. It's just whatever they do. It's like I was treating a dog with digestive issues the other day, and for the entire treatment, the dog was just burping in my face, and it was just okay, go for it, it's fine. And the owner was going, well, she never burps. So it's just like releases can come in any forms, you know. So it's whatever what happens. But yeah, she should have had a few mints before. That's all I can say. Okay, my next slide. So emotional release. Okay, so this can be a bit of a biggie. Body tissue can hold on to emotions associated with injury, abuse, unpleasant experience. These emotions can be released as the tissue is being released. This could lead to episodes of anger, agitation, nervousness, etc., as the dog is processing this release. I'll always work closely with the behaviouralist, the vets, whenever there's an emotional aspect or illness, but I would really like to emphasise that I won't work on a dog with really severe emotional complications without the owner working with a behaviouralist as well. Because I think the dog needs all the help it can get from every angle when they've got real sort of like emotional stress. You know, I think they deserve it. Because I only treat the body and the tissue. I don't treat the mind, as in the psyche mind, or the environment. You know, that's the behaviouralist. You know, they do need expert help with that. And I even encourage the behaviouralist to come in to the treatment room and while the dog's having a treatment, because it may help relax the dog, saying that they're there. For instance, Zion is like, Mark is Zion's superhero. If he's there, it's going, yeah, that's no problem. You know, I can cope with it. They're not going to kill me because Mark's there. So, you know, it may just help that bit if we can all work together. And same with, if it's a medical condition, I always say seek veterinary advice first as well, because at the end of the day, you've got to be safe with the dog as well as treating it, because we are holistic, as it were. You know, you've got to be responsible and take that dog to the vets if it's a serious illness or something like that.
So I've got a few questions for you. So if you had a dog, in this case, let's use Sherlock in this instance, because I know Sherlock. Would you advise those people in particular in the first instance maybe to have a few just sort of meet and greet sessions so that he can get to know you, you can get to know him? At the same time, would that always need to be a session at your clinic, or can you do this at the home?
I can do it at the home. I can do it anywhere. As long as I've got my hands, I can do it anywhere. So that's absolutely fine. Yeah, and especially if they are really nervous, they're really unsure, it's, you know, I'll just sit there and just let him smell me. You know, it doesn't matter. Take it at his space, you know, his rate. I don't want to overforce things, you know. It's literally do it at his speed. So yeah, whatever, I can go anywhere.
Okay, and how would you typically deal then if as the dog's releasing? I'm assuming at this point that release can come in, as you've already said, in many different forms. What would happen if a dog was to have a negative response, let's just say, to a release? What would that typically look like from your point of view, and how would you deal with that going forward?
Excuse me. Yeah, so, you know, not all releases are all sort of light and lovely and fluffy. Some are, the dog will growl, the dog will bark, the dog will maybe even turn and try and bite, because it's the emotion has caught in that tissue. and I'm releasing that bit of tissue. So it's releasing that bit of motion that got associated with that injury. So for instance, the dog was beaten, and that injury, he's associated that's that bit of damaged tissue is associated with that emotion. So they're interlinked. So I'm releasing that part of the body. So he's releasing how he felt at that time, which is absolutely fine. You know, that's what they need to do. Humans do it. You know, I have people swearing and want to punch people. You know, it's part of what cranial is. I'd stay in contact with the dog as long as it's safe to do so. For me, the dog and the owner, you know, I'm not going to stay there if it's just going to be dangerous, basically. If I do break contact, the release has started, so it will continue. The tissue will continue to release if my hands are on it, as long as it's started. So he's quite happy to then do whatever he needs to do, growl, go mad, throw himself on the floor, whatever, you know, it's started. Once the emotion has passed, which it will do, it will then go and it'll be back to normal. I'll go back and I'll either concentrate on just bringing his parasympathetic up, getting him to be relaxed again, settle him down, and I may not even go back to that area, you know, if it's a big one, and I'll just continue the emotional release next time. Sometimes, this is a big key though, sometimes dogs aren't ready to release the emotional part quite yet. You know, for some reason it's got to maybe linked with something else to be released. We've got to respect it. We must trust them, and they know themselves. We must trust them that they will release it when they feel ready to. You can't force an emotion release or a tissue release. The dog, at the end of the day, the dog is self-healing. You know, we're there to facilitate it. We're there to help him, but the dog is doing its own work. So you can't force somebody to do the work, as it were. It's hard to say, you know, that's what we do, this is what we do. It's literally, we're led by the dog.
Sure. And I'm, you know, obviously there's no two dogs, the same as humans, that are going to have a result at the same time, or what, you know, it's impossible to say how long things will take, because it's the same in my business too. However, once you've got a dog to a particular state that they're comfortable, they're healing, they're doing this, that, and the other, would you then recommend sort of regular maintenance on the dog? And would that be monthly, bi-monthly, quarterly? Would it be, you know, like the dentist, twice a year type thing? What would you typically suggest with a typical dog?
So basically, again, like my onion analogy, you go through all these layers that have issues from birth to present day. So we work through those layers, but everyday life will add more layers on. So to get the body and the tissue really responsive, I would suggest having a few fairly close together. Then you can then reassess the dog in 2 weeks' time, and then you can gradually have it as a maintenance thing. So, you know, if, for instance, the dog does, I say, agility, to just check in to see, you know, is the dog okay? Because the dog won't, you know, they're amazing creatures at taking hits. You know, they just get up, shrug it off. It takes a lot, really, for them to start showing symptoms. So it's good to just be on top of it as a preventative once you're where you want to be with an injury or a disease or whatever. And then you can then take it forward like that. Same with humans, you know. I would always suggest coming in, and then almost the body tells you then when it needs another treatment once you're where you should be. Cool,
good stuff. So you've got a few more slides, haven't you? Yeah. So we're going through these quite nicely.
That's right. So this is, I do love this little photo, I have to say. It's CST is helpful for treating following canine conditions and situations. So again, I've got my big list. I'm just going to point out or pick out a few, because obviously you guys can read it. Pick out a few and have a bit of a quick chat about them. So hip dysplasia. So it's quite a big and common one, isn't it? Because it's an abnormal joint structure that develops in the growing stages, the result is looseness of the joint. And then later in life, it turns to degenerative disease or osteoarthritis. CST can't cure it, you know, but we can help the dog manage it with taking down the inflammation in the joint, ligaments and surrounding tissue. It can also help relieve pain. And that's the thing with CST, is that, you know, some things can't be cured. And that's the same with humans, you know, things are just how they are, but CST will help the body cope with how it is and what degenerative issues come with it. So it's sometimes you just think, okay, it's that, but we can help that dog deal as best as it can with what it's got, kind of thing. Leg injuries and lame. So depending what the leg injury is, for example, pulled muscle, and the dog goes lame, CST can help the dog repair and release its injury. So it will help the muscle sort of like rebuild, as it were, or, you know, get more fluid into it, get more blood into it. If the dog's paralyzed, again, we can't do anything about that, but CST is good for keeping that limb or limbs healthy. You know, it still brings the blood supply, it still drains the lymph for them, so it doesn't suffer any more pathology in that limb or hindquarters or whatever. So it's a good thing for just like a maintenance. Improving flexibility and mobility. CST is good for releasing tight muscles, tendons and ligaments, which can help the flexibility of the dog. It works to soften the collagen fibers in the tissue, so it stretches them out, increases the fluid flow to that, and take any inflammation in the joint down. So it just helps the body repair. Head injuries and traumas. Like I said earlier, we know dogs are very good at, just for instance, they're playing and they whack their head against the wall and then they carry on playing like nothing's happened. But that impact, if it's severe enough, will stop the movement of the cranial bones and compress them. There's also nerves which run quite close to the surface. So feel the individual bones, see which ones are moving, see which ones are jammed. I'll release the sutures of those bones so they can then start functioning properly. I can locate the damaged area of soft tissue and then help the muscles again heal themselves. Spinal injuries, so that is quite a big one. It covers from things like IVGD type 1 and 2, intervertebral disc disease. This type 1 is the quick onset of it. Type 2 is the slower gradual onset. Different to dogs to humans. So in dogs, you get more of a shearing force, where humans you get more of a compressive force. It's just the way obviously we stand and the dog stands. Paralyzation, it will, in severe cases, surgery is an option if caught early enough, but CST is brilliant for the rehabilitation of post-surgery, and it also in mild cases of this disease, you know, it helps relieve the inflammation of the herniated disc, which presses on the spinal cord. Most dogs suffer in the thoracic lumbar, got the roach back. If the dog's really thick set neck, then they usually have it more in the cervical vertebra. Wobbler syndrome, again, affects horses as well as dogs. it's a degenerative changes in the cervical spine, and it's a compression. So it compresses on the spinal cord, mainly seen in large dogs, but can affect small dogs. Usually C5, 6, and 7 can show muscular weakness in all 4 limbs, but worse in the back legs. So that's quite interesting, really, because sometimes people think it could be that the problem's lower down in the spine, but really it's actually coming from the neck. CST can help keep the spinal cord moving and free of restrictions as possible. So I'm working on the dural tube, the cartilage rings. So you've got cartilage rings that go around the dural tube, which keeps it sort of like in place, so it's not affecting the spine, the spinal cord. I will then work with the nerve sheaths that come out of the nerves out of the spine to make sure they're moving properly, that everything's flowing how it should be, just to help reduce the dog's pain as well. A bit like sciatica, you know, it comes out of 5 areas. You've got to make sure that is released and free from compression, and because that's what sciatica is. We can help other injuries in the back and spinal cord. For example, dog suffers whiplash in the car, or if it's run at the end of the lead, heaven forbid, on a collar, it can then cause dysfunction through the cervical spine, and the first vertebra will jam into the occiput. So that's your OCB picture I had earlier. And we just help the bones go back to where they should be, you know, realign them. Scar tissue is also very good for, because scar tissue can be really painful because it's less flexible than the surrounding tissue. It pulls, it's a sharp pain. It can be on the surface or internally. CST helps to reduce the scar tissue by allowing the body to break down the coarse fibre of that scar. A bit like, I don't know if you have a sports massage, you know, they pummel it out, but with basically a lot of force and a lot of pain. So CST does the same thing, but a lot gentler without the pain. Excuse me. So it helps, if it's a recent scar, CST will help flush that scar with fresh blood to help scar heal itself. It will drain any fluid edema from swelling from the operation or whatever around that wound. Blocked tear ducts we spoke about earlier. This condition is for CST can basically help drain the lacrimal ducts, and so the fluid flows freely, and also decompress the bones. Breathing issues. Again, there's lots of breathing diseases now in dogs, and also breeding, which has changed the structure of the nose and being able to breed. Unfortunately, it's going to take time to get those breeding whatever's out back to how it should be, even if they ever will, we don't know. CST can help breathing by making sure that airways and sinuses, nasal bones are free from this restriction as much as possible. If the dog suffers from asthma, I can work with the tubes going down into the lungs. I can work with the lungs itself to help reduce the irritation and inflammation of the lungs. And lastly, CST, again, arthritis, it can't cure it, but again, it can make the dog more comfortable by reducing the pain, the swelling in the joints, and the crystallization of the fluid. It can just help break everything down a little bit, but again, it's not going to cure it. So it's one of those things, it's more of a maintenance to keep the dog comfortable. Okay.
Oh, we've got a question for you. I'm going to assume before that this possibly goes into more of an emotional thing as opposed to a physical thing, but Scarlett's just saying, can CST help with car sickness in dogs if the sickness is anxiety or trauma related?
I really can't see that it wouldn't help, because at the end of the day, if you can bring them down and get them to sort of like, for instance, if you're in the car, treating him in the car, to bring that parasympathetic in to help him relax, then it's not going to trigger that anxiety that's going to make him sick. So anything's possible, absolutely.
So I think Scarlett, you need to get in touch with Claire. This could be our own unique little case study going on here. This would be really, really good. First-hand experience and all that kind of stuff.
Yeah.
So it could. So, I mean, is there other things like the car sickness that potentially this it could help with? I mean, if there's, I don't know, a dog's anxious about going into wide open spaces, for argument's sake.
Yeah. Again, I would always work closely with, say, you, so you're there, and then we can then assess his if he's happy. Again, this is the key. If he's happy for me to then treat him in that area, I can then bring the calming and releasing, and maybe it will release the emotional side as well as the tissue, because it's triggered, because he's in the bit he doesn't like or he's scared of. So again, it's literally, I can't absolutely say definitely, because it's so dog led or client led. He may not be ready to release it. You know, it's one of those things, you literally are, it's an unknown until you're there with your hands on treating him in that situation to see what's going to happen, really.
Okay, so I mean, if you're with, obviously, a client's booked you, I'm imagining that there must have been times, or there will be times, where you kind of start to work and you'll know that the dog's not happy, and then you have to sort of call it an end to that session. How would you go about? Because there must be some people that at that point go, "I've only been here 5 minutes. What's going on?" You know. So I think at that point, are you then trying to just say, "Look, not ready for a full session just yet"? I mean, how does that kind of work? Does it need more time to build up to get used to it?
Yeah. So, you know, if the dog is in a treatment and I've put my hands on, and it's the same like a human, you know, I can put my hands on and I can feel that a human isn't ready to be treated, you know. So I will literally spend the time, it's called melding and blending and staying neutral with no agenda, literally holding the space. That sounds a bit cuckoo, doesn't it? But holding the space for that dog until that in itself is a treatment, but it's literally, I can just be sitting there with my hand on his back and I'm still feeling everything going on, but I'm not actually going, right, okay, we need to release this because this is restricted. I'm just holding the space, waiting for him to tell me that, you know what, okay, you can go to the next stage, or you can go to that one. You know, it is literally, it's building trust. That is the biggest thing. You've got to build trust with them. And the tissue, you have to build trust with the tissue. The tissue, I always have it as a third person, you know, the tissue is alive. It's a person to me, you know. I've got to show that tissue that I'm not going to hurt it. It's got to trust me. It's got to then go, okay, you're okay. I can now feel ready to do a release. And it's the same. It's the same with humans as well as animals.
Excellent. Well, I think we've come almost to the end there. And if anyone's got any questions, just briefly before we end the session, please do type them on. So we'll give them a couple of minutes to do that. But in the meantime, that was actually fascinating talk. I like that a lot. There was a lot in there, a lot of information. I think that could have quite happily have been 4 different talks. My brain's currently completely awash with information at the moment. But yeah, it's absolutely great. What I'll do once we finish here, I'll just pop into the comment section a link to your your website and a link to your Facebook page so people can get in touch to ask questions. Zoe said, thank you, really interesting, with a little love heart. That's nice.
Oh, perfect. Thank you.
So people can get hold of you that way as well. I mean, do you have, because obviously we on Into Dogs, we've got people all over the world. So I'm assuming you'll have an area where you would preferably work. I mean, is this something you know, so if someone gets hold of you from Australia, you know.
Oh, you know, if they pay for the flights.
Well, there is that, of course. So that might be a good thing as well. But is there a kind of distance that you would prefer?
Yeah. So a bit like yourself, you know, I'm mainly in Storrington. I can travel to further afield, but we could do that on an ad hoc basis and then discuss that if anybody is interested, sort of thing. And
I assume like me, then you've likely got other colleagues in other areas of the country that you could send people to.
So much dogs.
Right.
There's not many. This little colleague moved down from London. He's in Brighton now, but that's pretty much. There's not many people which treat dogs. Equine, quite a few, but not dogs. So.
Okay. Well, Scarlett said, thank you so much. She will be in contact, Claire, and she's put in brackets, thanks, Mark. So you've got, and I know she'll get in touch.
Well, I'm on the social walk Sunday, so we can chat from afar because I have my boys' eye on. So.
Yeah, absolutely. So that's absolutely fantastic. So brilliant. Okay, well, I'll pop a link to the website and the Facebook page in the comments after this. Thank you very much for coming along and agreeing to do this. Wasn't quite as scary as you thought, was it?
Oh, I don't know about that.
Well, this has been recorded. I will post it again in a couple of weeks' time so people can catch up with that. But we'd love to get you back at some point as well. Do another one. Once Denise is back with us again, we'll have Denise on because she'll have lots of questions for you. So that'll be an hour in itself. That'll be quite good. But it's brilliant. It's such a fascinating topic. And again, it's not something that you hear about very often.
No, it's really popular. It's massive in America for the humans as well. You know, some Scandinavian countries have CST therapists in maternity wards, so they treat babies as soon as they come out. Some GPs actually prescribe it as well in some countries. So England is a bit on the back foot regarding CST, sadly, but hopefully get it out there would be much better.
Excellent stuff. Well, I think that it's time to say goodnight to Facebook. And do you want to unshare your screen, and then we'll say goodnight to Facebook people. Thank you, Facebook, for joining in, listening to us. Thank you, Claire, for coming along. We are going to get you back for another talk at some point, but we will love you and we will leave you. Take care, everybody, and we'll see you again soon.
Bye.